Even though Obamacare is law, more than 150,000 Kansans are still without medical insurance.
A plan to provide insurance to all those Kansans is now before state lawmakers. KSNT News' Caitlin Berry was at the State House today as testimony in front of a House committee began and says lawmakers got an earful.
The droves of people who turned out in support of a bill to expand Medicaid coverage provides just a small glimpse at the thousands who are still uninsured around the state.
It's something that would affect a huge percentage of the population, so everybody should be concerned.
Marceline Dover is one of many among them. She was diagnosed with multiple sclerosis last fall and can't afford the insurance she needs to stay healthy.
It's a terrible struggle going through having a disease and then having to pay for it and not having insurance.
Right now she makes too much to qualify for discounted rates on Obamacare and doesn't meet strict requirements for the state's private Medicaid program known as KanCare. It's a gap in coverage 150,000 other Kansans also fall into.
The reason it's needed is because under the Affordable Care Act, the law was written assuming that all these people would be covered by a KanCare expansion.
But they're not right now. That's exactly why they're pushing lawmakers to remove the stringent requirements and expand KanCare.
Critics of expansion will have a chance to make their case next, and their main concern is expected to be costs. With the state's budget woes, they wonder where the money for such a large expansion would come from. Caitlin Berry, KSNT News.
That hearing continues tomorrow afternoon at 1:30.